high blood pressure is a silent killer, and high blood pressure itself does not kill. However, the bad effects of high blood pressure to our body organs causes complications which affect human life, and in the end can cause death of an individual. And in today's video, we are going to talk about the bad effects of high blood pressure to our body, and focusing on mainly the 5 common effects of high blood pressure. Number 1, stroke. High blood pressure can cause death of brain cells within our brain, and in the case an individual will suffer stroke, which can affect a specific part of the body, for example the hand, the limbs, or it can affect half of the whole body or part of the whole body, or in our state the whole body can be affected depending on which type of stroke the patient has gotten. Number 2, it can cause kidney damage. Remember, high blood pressure affects the nephrons within our kidneys, which are responsible for the functions of the kidney, for example, filtration of our blood and other associated functions. And therefore, high blood pressure on destruction of the kidneys, the kidney nephrons, it can lead to kidney damage and kidney disorders, and lastly, kidney failure, which is not good for our bodies. Number 3, it can cause damage to our sight, leading to vision loss. Remember, our eyes are very sensitive organs of the body, and any alterations in the blood pressure to blood vessels supplying the sight or the retina and other body parts, in case such blood vessels are affected, then an individual is liable to losing his or her own vision. Number 4, erectile dysfunction. High blood pressure on its own damages blood vessels. And remember, erection in men is always attributed to high blood pressure, to blood pressure within the veins and the arteries of the penile muscles. So damage to blood vessels within the penile muscles due to effects of high blood pressure can cause erectile dysfunction in men having high blood pressure as a disease. And hence, individuals experiencing erectile dysfunction should be screened for high blood pressure to rule out any hypertension, and in case it's there, it should be managed as soon as possible to avoid its complications. And lastly, we are going to talk about pregnancy complications. High blood pressure on a big extent contributes to preeclampsia in our pregnant mothers and wives. And in the end, this has led to death of both pregnant mothers and also, at times, the neonates or the fetus within the womb. And it has also contributed to emergency deliveries and also preterm deliveries in some mothers. And in the end, this affects quality of life of our newborn babies, our pregnant mothers, and also the mortality rate going high. And therefore, in this case, we urge all pregnant mothers to attend the antenatal visits as secured to avoid effects of high blood pressure. Thank you, and see you in our next video.